So we did our mini-series lecture on hydrocephalus. For a simple overview description of hydrocephalus, it is when there is a buildup of cerebrospinal fluid within the ventricles that are located deep within the brain. This cerebrospinal fluid usually flows throughout the ventricles. It surrounds and cushions the brain. It kind of acts as a shock absorber. However, an excess amount of this cerebrospinal fluid can cause pressure on the head. This is more of an issue in babies and young children that have hydrocephalus because it can make their head expand as their skull bones are not fully formed, they're still soft. Within older adults, when their skull is formed, this will cause more painful headaches and increased pressure as there's nowhere for the head to expand and go. For the incidence and prognosis of hydrocephalus, a study by the University of Utah shows that about 0.6 of all pediatric hospital visits are because of hydrocephalus within the United States. There is also the report that about 1 or 2 per every 1,000 babies are born with hydrocephalus. For the prognosis, it's pretty difficult to predict. There's treatment options such as shunts. However, there is not much known as to the degree of how the shunt minimizes or reverses the damage within the brain. Hydrocephalus poses a big risk to cognitive and physical development within the children. Children diagnosed with this disorder benefit greatly from rehabilitation therapies such as OT, as well as educational interventions, and they can go on to lead pretty normal lives. However, if it is left untreated, it can be fatal. The key to hydrocephalus is an early diagnosis and early treatment that can greatly increase the patient's quality of life and increase the chances of the child's recovery and being able to live a relatively normal life.
For hydrocephalus diagnosis, the doctor of the child will look for physical signs that can link to hydrocephalus, and we'll talk about these characteristics later on. Also, hydrocephalus can be diagnosed before birth, third trimester of pregnancy, or after once the child is born. Another way to diagnose hydrocephalus is measuring the circumference of a child's head. Imaging technology is the most prominent way of diagnosis for hydrocephalus. However, in the past, measuring the circumference of the child's head was another way to determine if there has been abnormal growth within the skull. A professional will measure the circumference of the head and look at a chart to see if the child is in normal range of their age. This helps doctors track the brain's growth as the skull is bone fused together.
So as we discussed earlier, imaging technology for the diagnosis of hydrocephalus is the most prominent way to determine if a child will be diagnosed with hydrocephalus. So the first one is a neurological exam, and this depends on the child's age. Also, the neurologist may ask questions and conduct relatively simple tests to judge muscle condition, movement, and how well the senses are functioning. The second is brain imaging, and this is determining if there's enlarged ventricles caused by excessive cerebrospinal fluid. These types of brain imagings include ultrasounds, MRIs, and CT scans. So the next imaging technology is ultrasounds. So these are high-frequency sound waves to produce images, and they're often used for initial assessments for infants because it is a relatively simple, low-risk procedure. An ultrasound may detect hydrocephalus prior to birth. So the next one is MRI, and these are radio waves in a magnetic field to produce detailed 3D or cross-sectional images of the brain. Although this test is painless, it is still very loud and requires the patient to remain absolutely still in order for this to work. Lastly, there's CT scans. These are specialized X-ray technology that can produce cross-sectional views of the brain. This test is also painless and quick. However, this requires absolute stillness. Children are often given a mild sedative for this test. So here we have an brain imaging of a normal brain versus a brain that has excessive cerebrospinal fluid. So basically, in the right hand side of the image, the black section is the cerebrospinal fluid. So as you can see, there's way more cerebrospinal fluid in the brain that is not normal, and this can cause an increased pressure in the brain, which can lead to several complications within the cavities of the child's brain.
Hydrocephalus is a congenital condition causing skull enlargement in children. The structures in the head expand, causing a bulging soft spot, which can lead to a variety of symptoms and can be life-threatening at any age. Three main causes of this include too much production of cerebrospinal fluid. A blockage develops that does not allow the cerebrospinal fluid to drain properly through the ventricles and the spinal cord. And the third main cause is blood vessels having a decreased ability to absorb the excess cerebrospinal fluid. Some underlying causes of hydrocephalus include the spinal column not closing properly, causing a birth defect within the first month of gestation. Infections such as rubella can contribute to hydrocephalus, and/or genetic abnormalities from either the maternal or paternal genetics. Some specific classifications of hydrocephalus include obstructive, communicating, and normal pressure hydrocephalus. Obstructive is the flow of the CSF is blocked after it exits the ventricles. Communicating is the flow of the CSF is blocked along one or more of the narrow passages connecting the ventricles. And normal pressure hydrocephalus is obstructive hydrocephalus that can appear at any stage of life due to trauma, surgery, tumors, or anything else, most commonly in the elderly, and it is most common in infants and adults. Quality of life is affected by hydrocephalus. Secondary characteristics of hydrocephalus affects multiple domains, including physical and cognitive. Some physical characteristics include headache, seizures, fever, urinary incontinence, a larger head, or gait disruption, like short shuffling steps. Some cognitive characteristics include memory loss, aphasia, slow reaction time, easily distracted, and cortical dementia.
So some medical implications for hydrocephalus. One is shunting. This results in long-term drainage of the cerebrospinal fluid. So this is a surgical procedure that helps restore the balance between the production and absorption of the cerebrospinal fluid. The shunt will divert the cerebrospinal fluid from the head to another area using a catheter. Most commonly, it is diverted out through the abdomen. However, many children will require a revision to this procedure because an infection or things will get in the way of the shunt as they grow older and grow in size. The other is an endoscopic third ventriculostomy. This procedure is an alternate to shunting. It's most commonly used in children that have non-communicating hydrocephalus. What this procedure does is it perforates the floor of the third ventricle, and this creates a new outflow route for the cerebrospinal fluid. It gives the cerebrospinal fluid another place to go. This does avoid implants like the shunt does, or it avoids the implants of something that the shunt would do, but it is not feasible for all individuals. So this picture shows how a shunt would work within a child's head. As you can see in the picture on the left, the ventricles are enlarged within the head. This is causing pressure along the outside of the head. A shunt will be placed within the ventricle, and then you can see the catheter that is running down, and that, as we talked about earlier, will usually drain the excess cerebrospinal fluid out through the abdomen. So some therapeutic implications for hydrocephalus and some ways that an OT can influence them and help them out have to do with learning difficulties, especially in the areas listed on the PowerPoint. As for attention, these kids can get easily distracted. For an OT, we can work on attention skills with that. Language, they're going to have poor comprehension skills. For memory and learning, they have rapid loss of information over time. They'll have difficulty retrieving the appropriate bit of information from their long-term memory. They're going to have weak visual memory. So as an OT, we can work on different memory games and activities to help increase the memory of the child and keep their mind sharp. For the visual motor integration skills, they're going to have difficulty interpreting what they see in terms of shape, size, space, and distance, as well as matching their fine and gross motor skills. So as an OT, we can use different activities to integrate and work on those fine and gross motor skills. For example, we can use the activity of picking up beads to work on pinching That's an example of a fine motor skill we would be working on. For planning and organizational skills, they're going to have difficulty organizing themselves, planning ahead, and thinking flexibly. As an OT, we can help them to develop a plan and organize themselves, as well as help them work on a daily plan and schedule to help the child go about their day and hopefully ease any anxiety they may be having. And for typing and technology, if a child with hydrocephalus may have an impaired ability to concentrate and to learn in general, these factors also may be affected when they're trying to succeed in this area, as they're going to have difficulty with visual acuity, visual motor integration, their writing techniques, establishment of a dominant hand, and as well as a decreased interest or motivation. So as an OT here, we can use activities to work on their visual acuity. We can also help implement some assistive equipment to help the child with their handwriting and their writing techniques. So overall, OTs can help individuals with hydrocephalus that are appearing to have difficulty with these areas by designing programs and activities that will target each one of these areas specifically to help the child efficiently practice and become stronger with each of these tasks that they may be having difficulty with. So for some final overall facts about hydrocephalus, the first two we've touched on earlier. However, hydrocephalus is just about as common as Down syndrome, and it is more common than spina bifida and brain tumors within children. Hydrocephalus is also the most common reason for brain surgery within young children. And there is no known cure, although we have ways to treat and hopefully ease the symptoms of hydrocephalus. There is no known cure.